Are prednisolone eye drops absorbed systemically? Yes, prednisolone eye drops can be absorbed systemically. When eye drops are instilled in the eye, a small amount of the medication can potentially enter the bloodstream through the mucous membranes lining the eye or through the nasolacrimal duct, the tear duct, which connects the eye to the nasal cavity. Systemic absorption of ophthalmic solutions can occur through several routes. Conjunctival absorption. The conjunctiva, which covers the white part of the eye, has a rich blood supply and can absorb substances into the systemic circulation. Corneal absorption. Although less permeable than the conjunctiva, the cornea can also allow for the entry of drugs into the systemic circulation, albeit at a slower rate due to its structure. Nasolacrimal drainage. This is a common route for systemic absorption. The eye drops can be drained into the nasal cavity through the tear duct and then absorbed by the mucous membranes of the nose, which are highly vascular and readily absorb substances into the bloodstream. The systemic absorption of prednisolone from eye drops is usually minimal and considered clinically insignificant in most cases. However, in some situations, such as when large volumes are used, when the drops are used frequently, or when the patient has a compromised epithelial barrier in the eye, there can be more significant systemic absorption. To reduce the systemic absorption of prednisolone eye drops, patients may be instructed to perform punctal occlusion. This technique involves pressing on the inner corner of the eye, near the nose, for a minute or so after installation of the drops to temporarily block the tear duct. This method helps to keep the medication in the eye longer, reducing the amount that drains into the nasal cavity and subsequently into the systemic circulation. It's important for practitioners to consider systemic effects of ophthalmic medications, especially in patients who are sensitive to steroids or who may be using multiple steroid formulations concurrently. Side effects from systemic absorption of ocular steroids can include altered blood glucose levels in diabetics, increased blood pressure, and exacerbation of existing systemic infections, among others. Therefore, careful monitoring and appropriate dosing are essential to minimize potential systemic side effects.